Hi, it's Barry Joyce from Smart and welcome to this video. Now in this video I'm going to go through a category for CSCS test, hopefully give you some tips and some hints on the way to hopefully help you pass your CSCS test successfully. Now if you've been following some of this series of videos, I've got a number of videos with actual mock tests and also the categories. And there are 50 questions on a CSCS test. Out of those 50 questions, they are broken down into categories. So, for example, these categories in front of you here are all the categories you will get on your test. Now, there are 610-ish questions in total. You get 50 of them broken down into these categories. Now, as you can see here, we're on the health and welfare. Now, the health and welfare is the biggest category out of all 16. And as you can see here, look, there are 89 questions on health and welfare in this category. You are going to get 7 of these questions that we're going to go through now. So hopefully I'll get them right for you. I'm going to try, I'm not guaranteed, but hopefully also give you some tips along the way. So here we go then. So question 1 of 89. Now, like I always do in mock tests and in all the categories, I actually read the question out for you, or should I say I get the computer to. I read the answers. The voiceover you hear on the questions will be exactly the same voiceover you hear on your CSCS test.
If a worker is feeling stressed, when is the best time for them to address the issue? Only after the stress level gets so bad it causes an accident. As soon as they realise they have symptoms of stress. In about 6 months, if the issue is still causing them stress. When they have finished work and they are away from the workplace.
Yeah, nice straightforward one. As soon as you realise you're going to show symptoms, then you're going to report it.
Which animal is the most likely carrier of Weil's disease, leptospirosis, on construction sites? Rats, cats, rabbits, squirrels.
So Weil's disease, leptospirosis, is actually caused through rat urine. The early signs of Weil's disease is influenza flu.
When absorption granules from a spill kit have been used on oil, what action should be taken? Clear them up and place them in a sealed waste bag ready for specialist disposal. Clear them up straight away and put them into a general waste skip. Use water to help clean up excess oil before specialist disposal. Leave them on the oil for a few days before clearing it into the general waste.
Okay, so spills kit with used oil is classed as hazardous waste, and we have to segregate all hazardous waste into sealed waste bags ready for specialist disposal.
Which one of the following is good advice for helping to cope with stress? Get enough rest, drink more alcohol, keep it to yourself, work longer hours.
Okay, straightforward, you're going to get more rest.
Stress usually affects which type of person? Only managers, those with poor budgeting skills, anyone, older people.
Yep, stress can affect everyone.
How should absence records containing specific medical information relating to an employee be treated? The records can be shared with the workforce as long as they do not say anything. Confidentially, in accordance with data protection laws. As public information, in accordance with freedom of information. Provided to the rest of the workforce to prevent others taking time off.
Okay, so like all medical information, even at your doctors, it's got to be confidential in accordance with data protection law, in particular under the new GDPR rule.
In what situation are you most likely to catch Weil's disease, leptospirosis? If you work near air conditioning units. If you drink water from a standpipe. If you work near wet ground, waterways or sewers. If you work fixing showers or baths.
Okay, so we now know Weil's disease is caused through rat urine, where the rats hang around.
When is the risk of an accident occurring at work most likely to be increased? When a worker has used drugs before starting a shift. When a worker likes the music on the radio. When a worker arrived late for work. When a worker is experienced.
Okay, nice straightforward one. Using recreational drugs before the start of shift.
If a sink on site is blocked and the water supply has failed, what should you do? Find a plunger. Buy water from the vending machines. Get used to the situation. Speak to a supervisor.
Yeah, of course we're going to speak to the supervisor.
Which of the following is true of clearing waste to maintain a tidy site? Clearing waste should be carried out at the end of a shift. Construction sites are dirty anyway and do not need clearing. Construction workers are not responsible for clearing waste. Clearing waste should be a continuous process.
Okay, so which is true. So clearing waste should be a continuous process to prevent slips, trips and falls and ill health.
What is one sign that employees are feeling stressed at work? Increased productivity on site. High staff turnover rates. Fewer accidents on site. Long-term staff retention rates.
Which one of the signs of an employee feeling stressed? Well, you're not going to increase your productivity. High staff turnover means there's lots of staff that keeps starting and finishing with the business. It's not going to be low accidents, so I'm going to go with B.
Which statement about mental health is true? It always has an obvious cause. It is always caused by stress. It can have no obvious cause. It is never caused by stress.
Okay, so mental health has no obvious cause.
Which of the following are common mental health issues? Hand-arm vibration syndrome. Paralysis and halitosis. Dermatitis, skin irritation. Depression and anxiety.
Okay, a nice straightforward one. It is depression and anxiety.
Who should drive company vehicles? Any construction site manager or supervisor. Anyone with a learner driver permit. Any employee who is competent and authorised. Any junior apprentice workers.
Okay, for answers like this, whenever you see competent, authorised or trained, authorised and competent, pick it. It will always be the answer. Sometimes it might just say competent and authorised, sometimes it might say authorised and trained, or sometimes it might say authorised, trained and competent. It will be the answer.
Mind is a charity that does what? Provides advice and support to empower anyone experiencing a mental health problem. Provides housing for retired construction workers. Controls and monitors health and safety in the workplace. Represents people who are very intelligent and want to improve their IQ.
Okay, so Mind is a charity that provides support for anybody experiencing with struggling with mental health.
Reducing the risk of cuts and abrasions would require protection for what part of the body? Blood, hair, bones, skin.
Yeah, cuts and abrasions is going to affect the skin.
Which is the most important reason for keeping work areas clean and tidy? It will help you get more work in future. So you look organised to your supervisor. You will be less likely to have an accident. To stop the spread of infection.
Okay, less likely to have an accident is the relevant one there, i.e. slips, trips and falls.
A worker is taking medication which could affect their health and safety in the workplace and that of others. What should they do? Work harder on site. Go and see their doctor. Tell their manager. Take regular breaks.
Okay, so this one is they are going to go and see their manager.
What is the most likely source of hepatitis in this image?
So if you get this type of question, what we need to do is just go over the image and actually click on it. So make sure you click right on it. Don't just click there, because you might get that wrong. Make sure you fully click over it.
Being satisfied with your job can lead to what? Feeling less happy at work, feeling more stressed at work, feeling unpopular at work, feeling less stressed at work.
So if you're satisfied, it's going to cause less stress.
What action should shift workers take at work if they are taking time-dependent medication such as insulin? Not tell their colleagues each time they need to take their medication during the shift. Consult their doctor and inform their manager to help plan how to accommodate this. Only work shifts after they have taken their required medication. Ask colleagues to help them remember when to take their medication.
Okay, so they should contact the doctor and the manager to see how they can accommodate that, because some time-dependent medication, such as insulin, is it's life-threatening, i.e., threatens to life. If they don't take it.
A worker creates offcuts on site. Who is responsible for clearing them away? The foreman, the worker, the supervisor, the site manager.
Okay, so in previous videos I have talked about when the word supervisor or site manager comes up. 8 times out of 10, it's probably the answer, with the exceptions of some obvious ones. This one, again, it's an obvious one. So a worker creates offcuts. Who's responsible? Well, the supervisor and site manager is not going to pick up your offcuts, so it is the individual worker.
What would be a good way of reducing fatigue in the workforce? Rotating shift patterns, random start and finish times, regular start and finish times, early start times and a late finish.
Yeah, so reducing fatigue. So fatigue just means tired. So by having regular start and finish times.
What sort of rest area should your employer provide on site? A covered area, chairs, and a way to boil water and heat food. A canteen serving food, drinks, and cold sandwiches. A covered area with some comfortable chairs and running water. Employers don't have to provide rest areas, as long as rest breaks are provided.
Yeah, employers do have to provide, and they have to be covered areas with chairs, somewhere to boil and heat up food.
What is the main issue with using barrier cream to protect your skin? It costs too much to use every day. It can be broken down by some substances. It can irritate your skin and give you dermatitis. It is difficult to wash off.
Okay, so barrier cream, it says what it says. It's a barrier that protects your hands, and in some circumstances it can break down. The substance can be broken down by some substances.
Fatigue could affect work rates of a worker. What does this mean? They will work consistently as there are no issues. They will work more slowly as they will feel tired. They will be able to work faster as they will have lots of energy. They will work at the same rate but will need monitoring.
Okay, so again, fatigue, tiredness, so they're going to work slower as they are going to feel tired.
What are 2 ways of reducing the risk of transferring hazardous substances from your hands to your mouth? Putting barrier cream on your hands before eating. Washing protective gloves before each use. Washing your hands before eating. Wearing protective gloves while you are working. Using barrier cream for working activities.
Okay, so 2 ways of reducing the risk. So hazardous substances. So you are going to wash your hands before you eat. And you're going to wear protective gloves. Now, a good way for these ones, if you have a look at the answers you've picked, and then just go down and have a look at the ones you've left with. And do they really make sense? Not really, so I'm sticking with those 2 there.
When someone feels they may have mental health issues, which of the following is a good thing to do? Never ask for assistance. Wait until your symptoms are worse before telling your manager. Wait until your appraisal to tell your manager you are worried about your mental health. Ask for help as early as possible.
Okay, yeah, you're going to ask for help as soon as possible. Of course you are.
Which two of the following are the best ways to reduce the risks of slips and trips for pedestrians? Audio messaging being played. Warning sirens. Adequate heating. Adequate lighting. Good housekeeping.
Okay, so to prevent slips, trips and falls, you're always going to pick good housekeeping. Whenever you say good housekeeping, pick it. Whenever you say bad housekeeping or poor housekeeping, pick it. They will never be in the same answer. And adequate lighting. Now, again, just have a look at what you've got. Yeah, they're going to prevent slips, trips and falls. Possibly warning sirens, but it's asking you what are the best ways. So I'm sticking with those two there.
Which of the following can be an indicator of stress? Increased productivity. Inability to deal with usual workload. Feelings of confidence at work. Feeling valued at work.
So an indicator is something that will trigger. So what will really trigger stress off there or be an indication? Of course, it's going to be the inability to deal with unusual workloads. Excuse me.
What other illness can be easily confused with the early signs of Weil's disease, leptospirosis? Dermatitis, diabetes, influenza, hay fever.
Okay, I mentioned that in the previous questions. Early signs, influenza, flu.
When an employee returns to work after an absence due to illness, what should they speak about with their employer? Any treatment costs they have to pay to help them get back to work. The number of times they have visited their doctor before returning to work. The details of the illness to make sure no one else can catch it. The effects of medication they are taking which could affect safety at work.
Okay, yeah, so certain medications can make you drowsy and they actually do state on the box never to operate or drive machinery, so it's going to be that one there.
If your doctor says that you contracted Weil's disease, leptospirosis, on site, why do you need to tell your employer? Your employer has to warn your colleagues not to go near you. The site on which you contracted it will have to be closed down. It must be reported to the Health and Safety Executive, HSE. Your employer will need to call pest control to remove rats on site.
Now, not necessarily in this actual category, but in other categories, in particular general responsibilities, Health and Safety Executive stroke HSE in brackets comes in your answers quite often. Never pick it, with the exceptions of 3 questions. This is actually one of them. Okay, so if you contract Weil's disease, you're going to have to report it to HSE. The other 2 times you would contact HSE, one, certain accidents have to be recorded to HSE, and the other time is if you are injured and off work for more than 7 days, you have to inform HSE. Any other time on any category, don't pick it, with the exceptions of those 3.
Loss of appetite, fatigue and tearfulness are common symptoms of what? Hand-arm vibration syndrome, skin problems such as dermatitis, mental health issues or stress, repetitive strain injury and back pain.
Okay, hand-arm vibration syndrome, that's your halves, permanent damage to the fingertips, skin problems, handling chemical substances such as wet cement, mental health or stress issues is going to cause that, and repetitive back injury or injury and back pain, it's known as your musculoskeletal, so it is C.
With regard to drugs, which 2 of the following statements are true? It is always safe to work when taking prescription medication. Drinking alcohol makes workers' reaction times slower. Prescription medication can make people drowsy and affect their judgment. Only illegal drugs can affect a worker's safety and productivity on site. It is sensible to take stimulants when a large amount of work needs quick completion.
Okay, so it's saying which statements are true. Well, yes, drinking alcohol will make your reaction time slower, and certain prescription medication can affect your drowsiness and your judgment.
Which one of the following is true of the symptoms of stress? They are the same for everybody. They take a while to develop. They always develop very quickly. They can be different for each individual.
Like all mental health, it can be different for each individual.
Which of the following is a definition of work-related stress? The adverse reaction people have to excessive pressures or demands placed on them. The positive reaction people have to working excessive hours for extra overtime. The positive reaction people have to being given an additional workload. The abnormal reaction to additional responsibilities being given at work.
Okay, so this one, it's not going to be B and C. The abnormal reaction to additional responsibilities, normally that wouldn't be the case. So the adverse reaction to people having excessive pressures and demands, so I'm going to go with A.
Fatigue may be a result of what? Working long hours, good sleeping patterns, a healthy diet, good work-life balance.
Tiredness is going to be caused to working long hours.
What is the main risk to this worker wearing only these items of personal protective equipment, PPE? Eye injuries, cuts and abrasions to breathing in harmful dust, damage to hearing.
Okay, so with these type of questions, if you have a look at the image, and it's just basically asking you there, what is the main risk? So it's a risk is the likelihood of something happening. So eye injury, no, he's wearing goggles. Cuts and abrasions, is he wearing gloves? It doesn't look like he's wearing gloves. Breathing in harmful dust, he's got his RPE on, his respiratory protective equipment. Damage to hearing, yeah, so it's going to be cuts and abrasions because he ain't wearing gloves.
Select the two images in which the worker is correctly protecting themselves from possible cuts or abrasions. Washing no gloves, painting with gloves, carrying with no gloves, scraping with gloves, scrubbing no gloves.
Okay, so cuts and abrasions is to the hand, so anything 2 inches is correctly protecting, so anything where they're wearing gloves, so it's going to be wearing gloves, no gloves, no gloves, no gloves, so I'm sticking with those two.
What is the organisation The Samaritans? A political party which supports looking after vulnerable people. A trade union organisation offering financial and legal support. A charity that provides emotional support for people who are struggling to cope. A charity offering construction training to young, vulnerable people.
Okay, so the Samaritans, it's a well-known charity, provides emotional support for people who are struggling to cope.
Lone workers are most at risk from what? Violence, sleeplessness, paranoia, humiliation.
Okay, a bit of a tricky one if you haven't seen this before. Lone workers is people working by themselves. The thinking behind this is actually security guards on a night time, and they are most at risk from actual violence.
When a worker is fatigued, what could happen? They are more likely to resign from their job. They are able to work with increased accuracy. They will be more likely to have an accident at work. They will be able to work faster and be more productive.
Okay, so tiredness again, they will be more likely to have an accident, yeah.
How can physical stress of a job be reduced? Repetitive actions when working. making equipment challenging to use, job rotation and task variation, an increase in pay for the same job.
Okay, so, to cause stress, so we're going to not do boring, monotonous jobs, we're going to have a bit of a rotation, so rotation and variation of task.
When might people suffering with mental health issues need help at work? They will regularly need help to avoid them having a panic attack. Up to once a week to take some of the strain off them. When their site supervisor or manager says so. As and when a situation arises in which help is needed.
Okay, so again, nice straightforward, as and when a situation arises, pretty much straight away.
A work task results in cables from power tools running across a walkway. What action should be taken? While working, look out for anyone approaching to warn them. Think about cancelling the job because it is too dangerous. Consider using cordless tools or running the cables at high level. Put up signs that the fire escape is out of order temporarily.
Okay, so to prevent slips, trips and falls, we're going to consider using cordless tools and running the cables above head height.
What is the most important reason for keeping your work area clean and tidy? So that waste skips can be emptied more often. It saves time cleaning up at the end of the week. To recycle waste and help the environment. To help prevent slips, trips and falls.
Yeah, straightforward.
What should you do if you are concerned about a colleague's mental health? Speak to them about it. Speak to a doctor about it. Tell all the team about it. Nothing. It's not your problem.
Okay, so you're going to actually go and speak to them about it. Never judge anybody who you feel are experiencing with mental health or who are struggling with mental health. Speak openly.
Which of the following is the main cause of skin cancer? Exposure to ultraviolet sun rays. Working indoors. Skin being irritated by overalls. Working in rainy conditions.
Why should you not use white spirit or other solvents to clean your hands? They could block the pores of the skin. They could strip the protective oils from the skin. They will remove several layers of skin. They could carry harmful bacteria that attack the skin.
Okay, so let's have a look at this one. They could carry harmful bacteria. No, they will remove several layers of the skin. I'm thinking not, so they could strip protective oils from the skin. So I'm going to go with B.
How does tetanus, an infection that you can catch from contaminated land or water, get into your body? Through your nose when you breathe. Through your mouth when you eat or drink. Through an open cut in your skin. Through the pores in your skin.
Yeah, so I'm sure you've heard of the injection tetanus, and it's caused through an open cut in your skin.
If you suspect someone at work has been drinking alcohol, what should you do? Report the situation to your supervisor, as they may be unsafe to work. Get them to drink plenty of strong coffee before they go back to work. Get them to eat and drink something, wait 30 minutes and then go back to work. Ask them to stay away for an hour and then go back to work.
Okay, so what should you do? And again, please just, we're not going on telling on people to try and get people in trouble if it does come across these situations, because they're not only putting their life in danger, but they're going to be putting your life in danger as well. So you're actually going to need to report the situation. Safety. Think of yourself.
Which one of the following is it good practice for lone workers to have access to for personal safety? Telephone and alarm systems. A place to sit down. The correct tools. Energizing music.
Yeah, you're going to have regular radio contact.
If your doctor has given you some medication, which of these questions is the most important to ask? Will I fail a drugs test if my employer asks for one? Will it make me work more slowly and earn less money? Will it cause me to oversleep and be late for work? Will it make me unsafe to work or operate machinery?
Yeah, I mentioned before, so some medication can make you drowsy and unsafe to drive and operate machinery.
To help protect outdoor workers from the risk of skin cancer from sun exposure, what should be worn? A small amount of deodorant and vest tops. Extra moisturiser on the face and short-sleeved shirts. Low-factor tanning oil and short-sleeved shirts. High-factor sunscreen and long-sleeved clothing.
Yeah, nice, straight, simple one.
If the toilets on your site are dirty or do not flush, what should you do? Tell the person in charge of the site about the problem. Try to fix the faulty toilet yourself. See if you can use public toilets nearby. Try not to use the toilets while you are at work.
Yeah, of course, you're going to tell the person in charge of the situation.
Who has a duty to protect an individual from stress at work? The union, the employer, the government, the local authority.
The employer.
A worker is suffering stress caused by their line manager. What should they do? Find and follow the company procedures to address it. Get another job that will be less demanding. Complain to their manager. Try to work faster to keep the manager happy.
Well, you can't complain to the manager because if it's the line manager that's causing the stress. But key words here, follow the company procedure. Anytime you say follow this, follow that, safe system of work, follow the health and safety brief, follow the site induction, all of these are always going to be the answer.
Which one of the following statements about mental health is true? Mental health has to do with our general knowledge. Mental health is all about our intelligence. Mental health is all about how we think and remember things. Mental and physical health are directly linked.
Now, okay, so in this question, I'm not a mental health expert, and I would never claim to be one. It's a specialist job. Now, some people may disagree with this, but for your CSCS test, mental and physical health are directly linked. For your CSCS test.
Which one of the following must be provided on site? Breakfast, snacks, drinking water, free transport home.
Yep, drinking water.
Prolonged exposure to sunlight could cause what? Hair loss, abrasion, dental issues, burns.
Yeah, straightforward. Sunlight, yeah, straightforward. Had to think there.
What can help to reduce fatigue? Going to the gym less, taking regular breaks at work, eating larger meals during break times, drinking alcohol after work.
So it's going to reduce tiredness, taking regular breaks at work.
What is a potential negative effect of working shift work? Lower wages, productivity increase, worker fatigue, effective teamwork.
So negative, which is a bad thing. So it's got to be worker fatigue.
What is the best way for a worker to avoid becoming stressed because of an overload of work? Make sure they take medication before going to work. Put up with the extra work, but make sure overtime is paid. Speak openly and regularly with their manager or employer about workloads. Only do what is manageable because someone else will pick up the extra.
Okay, so you're going to speak openly and regularly about the workloads.
When should an oil spill be cleaned up? Immediately. It could cause someone to slip. When it has dried. Never. It will be absorbed into the ground. At the end of the shift.
So immediately, whenever you see things like that, immediately stop, do this, immediately report. It's always going to be the answers.
Rest areas on site should be equipped with which of the following? Settees and chairs, televisions and tables, seating and tables, seating and radio.
Yeah, seating areas with tables.
What should you use to clean very dirty hands? Soap and water, paraffin, thinners, white spirit.
Straightforward, soap and water.
What condition can be caused by direct sunlight on bare skin? Acne, rickets, dermatitis, skin cancer.
How can mental well-being be negatively affected? Having considerate friends, feeling valued at work, a happy home life, stress at work.
There can only be one because the rest of them are happy.
What type of work is most likely to result in fatigue? Quiet and interesting, exciting and enjoyable, new and challenging, repetitive and monotonous.
Yeah, of course, it's going to be repetitive and monotonous. That's why we try to have regular start and finish times.
What are the minimum facilities that must be provided on site for washing your hands? A cold water standpipe and paper towels, a water container, bowl and paper towels. There is no need to provide washing facilities. Hot and cold water, soap and a way to dry your hands.
Yeah, I've already mentioned it, so got to have good welfare facilities.
Which of the following can have symptoms of lack of concentration, anger and problems with sleeping? Sight loss, overeating, stress, repetitive strain injury.
Stress.
When should you apply barrier cream to your skin? As part of first aid treatment, when you can't find your gloves, before you start work, when you finish work.
Yeah, so barrier cream, it's a barrier that goes around to protect your hands, so you're not going to do it when you finish work, it's always going to be before you start.
What is one of the best ways to overcome negative workplace attitudes about mental health issues? Tell workmates that you are an expert in mental health issues. Make sure no one with a mental health issue gets hired. Avoid talking about it and the problem will resolve itself. Talk and listen about mental health openly and without judgment.
Yeah, we've mentioned that a few times now, so you're going to talk about it openly.
A worker with a full UK driving licence has been asked to move a machine they have never been trained on. What should the worker do? They can move the machine as they have a full UK driver's licence. Explain that they are not trained and competent to move it. Move the machine as long as there is a vehicle marshaller. Move the machine as long as there is no one else near it.
Again, another straightforward one. You're going to explain that you're not trained and competent to do so.
If a worker confides in a colleague that they have suffered from a mental health issue, what should the colleague do? Treat them as they would any other work colleague. Do their work for them because they might not be able to cope. Let other colleagues know so they can avoid working with them. Inform the site supervisor and first aider.
Okay, so again, treat them as you would. So you, again, never judge anybody, speak openly, and treat them as you would anybody else.
How can everyone on site help keep rats away? Put all food and drink rubbish into bins provided. Put rat traps and poison around the site. Throw food scraps over the fence or hoarding. Ask the local authority to put down rat poison.
Yeah, you're going to put food and drink in bins provided.
Workers are likely to suffer the highest levels of fatigue due to what? Appropriately designed shift work schedules and reduced production targets. Poorly designed shift work schedules and reduced production targets. Poorly designed shift work schedules and long working hours. Appropriately designed shift work schedules and short working hours.
So it's got to be one of the poorly designed shift schedules and reduced productivity targets. So it's not going to be that. So it's going to be work schedules and long hours.
Which disease is most likely to be caught through cuts, grazes or puncture wounds? Cancer, Legionella, tetanus, dermatitis.
Okay, so cancer is skin cancer, sun rays. Legionella is water, contaminated water. So your tetanus through cuts and grazes, and your dermatitis is your skin rash, so it's got to be C. Yeah.
Accidents and errors are most likely to occur in which type of situations? Taking medication correctly. Misuse of alcohol and drugs. On an empty stomach. Drinking energy drinks.
Yeah, the misuse of alcohol and drugs.
If a worker is feeling symptoms or showing signs of stress at work, what should they do? Speak to someone they trust, like a friend or someone independent. Arrive and start work at a later time. Tell the rest of the team about their problems. Eat or drink more during the day.
Yeah, they're going to speak to somebody they trust, somebody independent or a friend.
The ground has become muddy on site. What could be done to prevent the ground becoming slippery? Improve lighting. Improve signage. Treat the surface with gravel. Treat the surface with salt.
So the salt will be for snow, so we're going to treat it with gravel to stop people slipping.
Which one of the following statements is true? People experiencing mental health problems tend to be violent or dangerous. Mental health problems are rare among construction workers. Mental health problems are common and can happen to anyone. Learning difficulties and mental health problems are the same.
Okay, so which is true? Yes, mental health is very common. We've all got some form of mental health, and it can happen to anybody.
Which one of the following is most likely to cause stress at work? A lack of job security but a permanent contract. Job satisfaction but fear of redundancy. Job security and a permanent contract. A lack of job security and fear of redundancy.
Most likely. So if you've got if you don't know your job security, fear of redundancy, that's going to cause stress.
What may be the result of a worker being fatigued? An increase in errors made, a decrease in errors made, a decrease in knowledge, an increase in productivity.
It only can be one. It's got to be an increase in errors made.
When referring to protection, what is a high UV rate cream designed to protect you from? Legionella, sunburn, dermatitis, abrasions.
Yeah, we all know that now.
The effects of mental health issues at work can be managed by what? Call in sick to work regularly. Avoid personal discussions with our workmates. Talk about the issues with a supervisor or manager. Hide any difficulties from colleagues and your supervisor.
Yeah, of course you're going to talk about these things.
What should you do if there is nowhere on site to wash your hands? Speak to your supervisor or the site manager about the problem. Go to the local public toilets and use their wash basin. Wait until you get home, then wash them. Nothing, as the site does not have to provide washing facilities.
Yeah, if there's going to be a problem, you need to speak to your supervisor. Now, some questions in other categories will say speak to your supervisor or speak to the contractor supervisor. At all times, it's always your supervisor, because sometimes they may be in the same answer.
What can cause occupational dermatitis? Contact with another person who has dermatitis. Working in the sun without sun cream. Using tools that vibrate. Contact with some strong chemicals or substances.
Yeah, so the skin rash, dermatitis, it's going to be contact with some strong chemicals or substances, and the most popular, the most common one is wet cement. Whoa, what a category. So 89 questions in that category. That is the biggest category. You are going to get 7 of those questions on your actual CSCS test. As you've seen there, so out of the 89, there's at least half of them, so over 40 I would say, was on mental health. There's quite a lot of ones on fatigue that come up quite often. So understanding what fatigue is, what stress is. Hopefully I'll give you a few little tips along the way as well on how to answer those questions. And that's it. So I look forward to seeing you in the next video.